Now I wanted to go through a couple of exercises that are not in your coding handbook because I think they're good practice for reading a little bit more than one line and asking the questions that you have to ask to know how to code diagnoses. In this scenario, a 60-year-old female patient has a shortened right leg tibia that is of unequal length compared to her left leg. The deformity of her right lower extremity is a result of the fact that she had acute poliomyelitis when she was 3 years old. So what is the residual condition in this case? The residual condition is the deformity of the right tibia that is an unequal length compared to the left tibia. And the deformity is the result of the sequela. The deformity is the result or the sequela of the past polio that she had as a child. So that past polio infection would be coded as a sequela. So in our pathway, we begin with the main term, deformity. Next term, limb, acquired. In other words, it was not something she was born with. If she had been born with that shortened length, that would be congenital. Acquired, unequal length. Short site is the tibia. Takes us to code M21.76 dash. That dash meaning we need an additional character. So first let's start with our alphabetic index. We start with deformity and we go down until we get to limb. Here's limb. Go over another indentation and we're looking for unequal length. Here we go. Unequal length. Short site is, we know from our literature, it is the tibia. And here's the tibia. M2176 dash. Both the dash and this little black box with the white check mark mean additional character or characters are needed. So we then go to our tabular. Unequal limb length, acquired, tibia, and fibula. You notice that this category code right here is for the tibia and the fibula. But we also notice that a sixth character is needed. 5 characters are given. A 6th character is needed, so we're going to read through these sub-terms and codes until we get to what we want, and in this case, the first one is what we want. It's her right tibia. So our full code is M21.761. The next thing we have to look for is the sequela of the polio. So that is going to be the main term sequela, subterm poliomyelitis, B91. So let's go to our alphabetical index, and here we are under sequela. We're going to go all the way to the P's. Poliomyelitis, B91. So now you're going to go back in your tabular to B91, and it's a very simple, in this case, code, sequela of poliomyelitis. So B91 is the correct code in this situation. I want to bring to your attention here, though, this little excludes one note. If you remember, excludes one, you cannot use both the B91 and the G14 code. So you would have to examine your literature and be sure that you're coding the right thing. If your doctor has documented post-polio syndrome, that is a different diagnosis than sequela of poliomyelitis. So just kind of be aware of that. So back to our problem here, we have added our 6th character of 1, so because we're talking about this patient's right tibia, and we have our sequela code from B91. And which coding guideline helped me with that? Coding guideline 1B10, which is just as simple as the coding of a sequela generally requires 2 codes. The first code is the condition or the nature of the sequela, which in our case was the shortened leg length on the right tibia. And the sequela code, B91, is the second code. So your guideline gives you sequencing advice, not advice, a rule, sequencing rule, and tells you which goes first. Okay, here's another exercise not in your coding handbook that I just want to talk about because it is important and it helps you to know that for the most part, 99.9% of the time, you're only going to use physician documentation when you're coding. But there's a few situations where you are allowed to use the documentation from other providers of care because their documentation is more specific. And this is the case that I've chosen to illustrate this. The physician is saying the 36-year-old female is admitted for bariatric surgery with a right heel ulcer. Her admitting diagnosis is severe obesity due to excess calories and a right foot ulcer. If you only had that information to go by, you could not gauge the depth or the stage of that right heel ulcer, which is important in the situation of ulcers for many reasons, not the least of which are present on admission, which we will talk about as you become more familiar with coding in the hospitals. But the hospitals have to report what a patient comes in with, what stage of an ulcer, for example, they come in with. And if that ulcer gets worse, Medicare is not going to pay for something that happens in a hospital that the patient didn't come in with. So in this case, the staging of an ulcer is very important. It's also a more complete documented record when the patient's BMI, body mass index, has been documented, and the dietitian, as a normal part of his or her role, is going to document the patient's BMI on his or her report, and the nurses are going to document what stage a pressure ulcer is. So we know from the guidelines that we can use this documentation, dietitian's documentation for the BMI and the nursing documentation for the stage of the ulcer. And here's the full guideline that helps us know that. Is coding guideline 1B14 for the body mass index, or BMI, the depth of non-pressure ulcers, this should be non, not mon, non-pressure ulcers, and pressure ulcers. Code assignment may be based on medical record documentation from clinicians who are not the patient's provider, since this information is typically provided by other clinicians. And as I mentioned earlier, the dietitian often documents the BMI, the nurses often document pressure ulcer stages. However, the associated diagnoses with these conditions, such as a patient's being overweight, obese, or having a pressure ulcer, must be documented by the provider. So yes, you're going to be able to dig deeper in these specific cases, but you don't get your diagnosis from those cases. So here's our final codes, and I just wanted to go through these with you. Obesity, severe. Okay, we're going to go to the alphabetical index. Here's obesity. We can go down to severe, and it's E66.01. Notice also morbid, E66.01. Those words are sometimes used interchangeably. And also the doctor did mention it was due to excess calories, which again is the same code, E66.01. So then we go to our tabular, look up E66.01, E66.01, morbid or severe obesity due to excess calories. So that is the correct code for the obesity. Go in our alphabetic index, we're under ulcer, pressure, we're looking for stage 3, stage 1, stage 2, stage 3, heel, L89.6 with the little dash, meaning we need more characters, and also that little icon, the black box with the white check mark, we need more characters. So let's look up L89.6 in our tabular. And here we are, stage 1, stage 2, we need stage 3. So let's go to the next page. Okay, pressure ulcer of the right heel, stage 3, L89.613. I think that would fulfill our need for more characters. Yep, that's it right there. L89.613. And back in our tabular, body mass index 40 or greater, Z68.42 is BMI in the range of 45 to 49.9. So that is the correct code right there. All right, that's all I'm going to show you for Chapter 7. Please work through those exercises. You do not submit the exercises from the handbook. Let's also remember that in week 2 there is Exam 1. Exam 1 covers Chapters 1 through 7 in the coding handbook, and that includes the ICD-10 guidelines and conventions. If you have any problems or questions about other exercises in Chapter 7, you can post them in the discussion board or contact me personally, and I will walk you through how to get those answers. Thank you so much. Have a good week.